this meeting. Okay, just a short introduction before I share the screen and some ground rules for this meeting. I would love if you could have your videos on so I can see you. And I would also suggest that you put your mic off if you're not speaking. Otherwise, suddenly there'll be a lot of noises coming in. And if you have any things you want to add to the discussion, it's most welcome. Just use the kind of hands up emojis that are there, or you can also write in the chat if you feel like it. And then we can all see it. And Elaine saying that your video and mic are currently not working. Okay. Yes, perfect. You can just write it in the chat if you have anything to add. Okay, so I'm gonna share the screen now so you can see. Welcome to this first kickoff meeting in the Special Interest Group Sustainable. And I'm just gonna show you the agenda for the meeting today. And first off, we're going to have some introductions because I know some of you. I don't know all of you. And I don't think you all know each other between each other. So a short introduction will be the first thing. Then we're going to talk a little bit about, so what is the outcome of this meeting? What is it that we are going to agree or disagree on in this meeting? And then I'm gonna go through a little bit about the visions and the thoughts that we put into this SIG to make the proposal to have the SIG, and then discussing the activities we could have in the SIG. And I would very much like to do that with you. So that would be the expectation, wishes, suggestions from you that are most welcome. And then we're gonna maybe talk a little bit about membership. How could we get? How is it to be a member in this group? And are there any others out there that could be good to have as members? And then rounding it up with the kind of a direction. So where are we going from here? So this is the first kickoff meeting, and I am actually very happy to see all of you. So the first on the agenda was short introductions, and I can start off by saying that my name is Esben, and I'm associate professor in Copenhagen, and I'm the chair of the SIG. The co-chair, Kasper, has undergraduate teaching until 5, so he will be here when that finishes to introduce himself. But I think it would be nice just to have a short round of introduction, just who you are and where you're from, and maybe a little bit about why you think this is an interesting SIG to be part of. And I have all your tiles here, so I'm gonna take it from my perspective and just say a name, and then and that will be from my left corner. So that will be Guglielmo.
Hi, I'm Guglielmo Campus. I'm originally Italian. I am at the moment professor in cardiology and also public health in Sweden at the University of Göteborg. And my research field was public health. And so I think that sustainable is very, very important nowadays. Thanks for all of you to be here.
Thank you. And then actually we're going to Kenneth.
Hello, I'm Ken Eaton. I'm a past president of the ADPH. In the United Kingdom, it is a recognized specialty, and I'm listed by our registering body as a specialist in dental public health and also in periodontology. My PhD was dental public health. My master's many years ago was periodontology. My main interests now are publishing and writing. And as you probably know, I'm the associate editor for EADPH. It's nice to see that you have faces because I've seen many of your abstracts and you've emailed me. But at the meeting in Heraklion, it was so busy that I didn't actually get to speak to a lot of you face to face. I'm really here observing on behalf of the board, EADPH board, because I'm much tied up with the special interest group, which is looking at the improvement of the oral health of socially economically deprived, and that I'm the advisor to. So I think it's probably unlikely that I can get too involved in this group because I can't really work with two groups, but I can perhaps help you to liaise with other people I think will be interested. And certainly when it comes to publishing, I think I can help you there quite a lot.
Thank you. Perfect, Ken. And then Rikke, you're up next.
Yeah. My name is Rikke. I am Danish. I'm a dentist and I have a master in anthropology of health. For more than 25 years, I've been working in private and public dentistry, the last of those with emphasis on elderly people in nursing homes. As such, prevention in all healthcare has always been in my interest. I've been a clinical instructor of the dental school in Copenhagen, and that's how I got to know Esben in the first place. Lately, I've completed my master in anthropology of health at the University of Copenhagen. In writing my thesis, I was again in contact with Esben for brainstorming and external sparring. My thesis focused, in short, on what happens to the oral hygiene instruction between the dental hygienist and the periodontal patient. Anthropology it's about building comprehension of behavior and context through the study of human activity and interaction. And as such, I could maybe contribute to this special interest group. Since 2018, I've been living in Switzerland following my husband's employment here, but I travel back and forth to Copenhagen whenever it's needed, as I also have my family there.
Okay, thank you, Rikke, for that. And then it's Jurgita.
Yes. Hello. Good evening. My name is Jurgita Andruskienė. I come from Lithuania, from Klaipėda University, and I am dental hygienist from my profession, and I'm having the PhD in public health. And I got interested in this group because I'm participating in the health policy formation, and I'm the member of National Health Board. And this is the group of experts which are involved in the creation of the policy of health and primary prevention in Lithuania. So that is why I got really interested in the main topic of this group, just to know more, to find out more about the strategies of working in the communities and improving dental health. I think that it will be very helpful for me to share it with the health policy makers and just to influence some good decisions in this level. Thank you so much.
Thank you, Jurgita, and it's very nice to have someone with a political agenda and policy influence. Perfect. Thank you. Welcome. Okay, and I do apologize if my pronunciation of your names is not optimal. I'm doing my best.
Thank you.
and this goes for everybody, I think. So, Joke?
Thank you, Esben. I thought you were thinking about my name. It's indeed, you pronounce it very well. It's Joke. It's a Dutch name, but I'm from Belgium. So I'm a trained dentist, prosthodontist, and I'm currently a professor at KU Leuven, which is one of the 2 universities in Flanders, which is a part of Belgium. And actually, the research that we're doing now is to build health promoting programs for underdeprived groups, such as we have been building a program to be used in nursing homes. And I'm also part of a partner organization that is working for the Flemish government to actually implement these methods. So our task is to help in the development and the evaluation of the methods, which is of course very nice, because on the one hand, I have the cap on of the academic things that need to be done, and otherwise it can really be implemented. And so I'm very close to actually implementing the strategies within the population. And now we are actually at the start of also doing something for the people in the mental health setting, because people with severe mental illness also have a lot of dental problems, oral health problems. And so now we are in the thinking phase of how we could approach this target group. And so we're planning some studies on that. And so I'm very interested in this, because it's all about prevention, what we are doing. So I'm very eager to learn from this group and to share what we are doing, and to specifically also learn how you are doing things, and to, yeah, let's say, enrich each other. So I'm very happy to meet all of you, and thanks for giving the opportunity to being part of this.
Yes, no problem. Thank you very much, Joke. And it sounds like a perfect match. And I would love to follow your studies on the mental ill patients. That's a really important group. Okay, so Michiel?
Hi, Esben. I'm Michiel van der Linden. I'm an assistant professor at the Oral Public Health Department at ACTA. I was trained as a medical doctor with specialization in social medicine that includes public health. And to my view, that includes oral public health. But it's a specialization in the Netherlands. And with you, Esben, and Caspar, the co-chair of the SIG, and also Monique van der Veen, who's present here, and others, I'm involved in research in the European Deliver project about the connection between oral health and social care, to call it that way, at the community level. And in this project, we try to improve access to care, oral health care, and to improve quality of oral health care. So I'm very excited to learn more about what all the others do in this special interest group, and to bring to contribute to it from this research.
Perfect. Thank you, Michiel. And we'll go to Monique then.
Thank you, Esben. Michiel already introduced me. I'm actually a physicist, and I have been working in dentistry already for well over 30 years, first on designing diagnostic devices for dentists, learning that actually the patients were liking the tools much more than the dentist, and use them to start a communication. And then I sort of switched careers, because we noticed so many things going wrong in our society close by to our dental school regarding young children, and all these prevention projects where all disciplines were involved except oral. And so we decided that we needed to put oral health on the map. So I have got next to the Deliver project, where I'm working on with Esben and Michiel and others, also projects on Meta Health, which is aimed at improving health for vulnerable or children growing up in vulnerable circumstances here in the Netherlands. As well as a project that is aimed at improving oral health care and accessibility of oral health care for frail elderly living in home dwelling.
Perfect, Monique. Thank you. Very nice also to have the children's aspect actually in this, if we're really going preventive. Okay, then Ambrina.
Yeah, hi. So my name is Ambrina and my surname is Qureshi, and I'm from Pakistan, working as a professor of community and preventive dentistry. It's a public sector institute, and I've been working here for the last more than 15 years now. And I'm also chairing this department, which has 3 units under me. In addition to that, I'm also the principal of a school that is of the dental auxiliary, where I head the dental hygiene and the technology programs. And I've done my PhD in 2021. That was too late, but I made it on job. My PhD thesis was a clinical trial that was the periodontitis and the diabetes. Later on, we wrote a review for the Cochrane and updated the NICE guidelines and so on. Recently, we've submitted our project to the provincial government for the lady health workers to be used as a sustainable manpower who can work for the pregnant women, at least screen or examine them. And just yesterday we had a meeting with them. So since it's very fresh, so it was in my mind. I thought I should be sharing it with you. I think that's it. Yeah.
Okay, thank you very much, Ambrina, and welcome to you also. Then Lamis.
Hi, I am Lamis Abu Haloub. I'm from Palestine and I am now based in UK. I was a consultant for dental public health at the Ministry of Health in Palestine. I worked for around 20 years and since 2015 nearly, I started to work with Professor Paul Erik Peterson at the Copenhagen University. We work together to implement a school oral health program in Palestine. Then I moved to UK, and where I worked with different universities in implementing oral health interventions and evaluating the oral healthcare services in low and middle income countries. So my interest in this group, because my work is focused in low and middle income countries, I'm looking to know how to mirror and transfer the experience or successful experiences in high income country or any other countries to low and middle income countries. And also I have more focused on conflict areas or areas where suffering from political conflicts.
Okay, thank you very much. Very interesting. And I think a good discussion could be about, the countries in which we're doing the interventions at some point. Very interesting. Okay, so Elaine, you could not speak, so we will, oh, you wrote something? We can just read that. Yeah, that's fine, Elaine. Thank you very much. I think we can all read what you've written. So thank you very much, and welcome to you also. And hopefully next time we can also see you and hear you. So the last tile in my screen is Sogoli.
Yes. Hello. My name is Sogoli Rafi, and I am dentist and postgraduate researcher in dental public health at Department of Oral Public Health at Tehran University of Medical Sciences from Iran. and I'm a junior researcher, and my project now is focusing on kindergartens, and we are implementing a preventive strategy for dental caries in Iran's kindergartens, and which focuses on supervised toothbrushing in the environment of the kindergarten with the teacher of the kindergarten.
Perfect.
Yeah.
Thank you very much, Sogoli, and welcome to you also, and welcome to you all again. And now I'm going to share the screen again, and I'm going to go see if I can. Here we are, and we are back to the agenda. And now we've done the introductions, and then the next would be, okay, what are we gonna? Well, the introduction. I'm just gonna show a picture of myself and Casper. And Casper, he's this guy. He will be here hopefully shortly to introduce himself. So my idea of this kickoff meeting was that I can have a lot of ideas and suggestions of what to do in this SIG, and I do, and I have some ambitions, of course, but I would very much like to discuss with you if you have any other suggestions or ideas that we should go for. So that would be, are there any goals that we need to focus on in the SIG, or are there any activities that you think are like especially important to focus on? So this slide will also be the last slide when I've gone through all the other slides, so we can maybe put a little words instead of all the dots here. So now you can relax a little bit and listen, because I'm just going to go through my ideas. I don't know if you've all seen the video that I made of the SIG, but I'm just going to go through my thoughts and ideas about this SIG, so you know at least what our idea was to begin with. So what we really want to do is to kind of set a direction on this preventive strategies for oral disease. And we've written sustainable, and I'm gonna come back to that, what that actually means. And we've written community-based. And the reason why we've done that, I will also come back to, but we think that it's to actually change anything, we need to go into the communities. And I know policy is important as well, but how can we make good preventive strategies in the communities? And we have like two focus points. One is which strategies will actually improve oral health, and what are the kind of the approaches to develop and test such strategies. And this is something I've been working a lot with in some projects. So this was our initial thought. So what are the strategies, and how can we actually come up with such good strategies? So when we talk about sustainability, then in our mind, sustainability is about having a focus on prevention. It's about having some ownership and in the community. So it's not just us telling people what to do, because that will not be sustainable. We need to think, can we get some sort of interventions that are within the existing structures of what is going on? And we're thinking about co-creation, so involving all the stakeholders that are needed to be involved to create the best interventions. And when we're talking about strategies, at least this is something that Casper and I have talked a lot about, then we're talking about non-clinical strategies. So it's not about people coming to the clinic. It's about having prevention where people are. So it should also be non-commercial. It shouldn't be like relying on any technology, new technology, and it shouldn't be costly for the citizens, because we are focusing very much on the deprived groups, and then money is an issue. originally, the timeline for this SIG was 3 years. But we only are funded for 1 year. So the original timeline was that we would do kind of this establishing phase, mapping phase, and outreach phase that would be for 3 years. Now, when we only have 1 year, we need to speed up the process a little bit. So it's good you're here, Ken, because then maybe we can we can go on with the publications earlier. But if we have 1 year, then we need to decide, okay, we need to establish more quickly, and we need to see, okay, what is the output of this or the outreach of the SIG? And we're going to discuss that today. So originally, again, the output we just discussed, Kasper and I, should go to the public. It should go to research. We would do all kind of reports and SoMe campaigns and press releases and so on. But then again, if we only have 1 year, then we need to maybe be a little bit more realistic on the output of the SIG. So a suggestion would be to focus on doing some sort of research output that could also influence decision makers going the policy way, but also the NGOs, community workers, and definitely also the citizens. So that could be position papers or scoping review on co-created interventions or preventive interventions in community, focusing on dentistry, of course. And then we could do some SoMe, and it would be natural to do some sort of presentation of videos depending on the output. And now I'm just gonna throw in some suggestions for activities that we could have in the SIG. We could have like use it as like a knowledge sharing platform where we could discuss studies or publications. We could discuss projects. I know that some of you are working with projects that could be very relevant to discuss with us, the rest. We could call in some experts to give a talk on kind of what is co-creation, what is the best way forward if we want to go that way. And we could use it as networking, and I think we do that anyway. And there could be other suggestions. Then we could also use the SIG to create this output, so we could read publications and do this review things. We could describe our own projects or even create new projects, make presentations, videos, and make even a website if that's what we want to do, or use the EADPH website also. And how to do this? Well, right now we're in an online meeting and we can do that again for sure, no problems. We could have some webinars. We could write emails, and there is a meeting in Rome next year, the EADPH meeting in Rome, where we have like there's a physical meeting. So I encourage you all to come to that meeting at least, so we can see each other also physically. Okay, so now that was actually my introduction to the SIG, about the visions and the ideas that I have for the SIG. But now I would very much like to hear from you. And I've written these questions, and I suggest that we take them one at a time. So first off, this is also what you think would be most relevant, I think. So if you can, from the top of your head, I would very much now like to hear if you think we should have any specific goals or in this SIG. Yes. And I think Guglielmo.
I think that we have really to specify which goal we should to have, because 1 year is too short. So the goals have also linked to the activity, to the output. So now I'm speaking about my experience. So I was used to work a lot with several, let's say, deprived area or deprived country. And for example, during the Heraklion meeting, I speak a lot with other people that, like me, are involved in some African countries where there is really the need, starting from the WHO, what they said about the oral health or something like that. So I think that maybe, in my point of view, one goal will be to create, let me see, it's not really a consensus, but more or less a guideline, what is possible to do for this kind of population. Because when I was in Heraklion and I was speaking with several people also from Barrow Foundation, other people that are working, that we are moving like this in several African countries. Why not to try to coordinate it ourselves, writing a small guidelines, what is possible to do with no cost, no commercial, just for prevention about that. And now I'm thinking, I don't know how familiar you are about the system the WHO is developed for African countries about not communicable disease, but not for oral health. It's just another thing. Maybe we can adapt the system.
Thank you, Guglielmo. I think that's good suggestions to discuss if there could be any guidelines on the possibilities of preventing oral health in deprived communities. I think that's a really good idea. Okay, and Yuka?
Thank you very much, Esben. So I agree with Guglielmo that I think it's important to specify the goals because it's very broad, the goal that you brought up, of course, extremely relevant, but also if I see how much time it takes to actually develop something or actually be confident enough to give suggestions for strategies for a specific group, I think like a general recommendation also would take a lot of work. And maybe would not be so easy to implement if you don't specify that also. So I think that specifying the goals, I think, should be done. What I think like is also very important, and what I would also expect a little bit from this group to do this as evidence-based as possible, because I think that there is a very big challenge there. So on the one hand, we can say, okay, let's do it the very thorough way, like defining the problem, getting to know all the determinants, intervention mapping, to develop a methodology with strategies and so on, or go via co-creation, which is a process that goes a bit faster. And I'm also struggling with like, what should we do? Should we like first really get a very good grip on the problems of a specific group in a specific context? Or should we rely more on the co-creation, in which, of course, you also involve the people? So it is a kind of co-creation, but with the co-creation studies that I see nowadays, it goes like you have several workshops, and after these workshops, you already have like a first draft of a method that can be implemented and that can be tested. So that's something that I'm really curious about, how to deal with that as a research community. And secondly, I think it's also very important to say something about evaluation, because you see that, and it's the same for the things that we do in Belgium, so that we always have to evaluate, because if you don't evaluate, you are keeping things going that maybe aren't so useful anymore, or it should be like a dynamic process. And that is something that is very often where we fail, where actually sometimes money is put into something that has very limited output. And that is something that I think you see in a lot of situations, that actually we as a research community, we should put, I think, also a lot of effort in giving the signal that we should continuously evaluate and adjust and do that. So maybe when I was getting this invitation for the special interest group, I was thinking of that, like, what can we mean as a scientific community to do all this as evidence-based as possible in a feasible way, and keep it up to date. So make sure that the programs that are working, that is dynamic, and that they remain adjusted to the needs that are there for the groups.
Thank you very much, Yoke. And I have to say, I couldn't agree more with you. I think that's very important. So I'm gonna try to reframe your words, and you tell me if I misunderstood. But I understood a little bit that it's about the approach. So it's more about, how can is co-creation like an evidence-based way to go? So how useful is co-creation, especially when we talk about evaluation of the interventions? And I agree with you, all the co-creation processes and projects I've been in, it's been a huge discussion how to evaluate the effects of the interventions. So thank you for that. And now I can see that the co-chair, Kasper, has arrived. So maybe, Kasper, you could just shortly introduce yourself.
Yes, thank you, Esben. And sorry for the delay. Happy to meet everyone. I'm Kasper Rosing, an associate professor also from the University of Copenhagen, like Esben. I have worked a little bit with co-creation so far in a European-based project, and looking forward to work with everyone on this exciting topic.
Thank you. And I can also see that Karin has arrived. Hello.
Hi.
Welcome.
Hi. Thank you.
Shortly, could you just tell us who you are and where you're from?
Hello, everybody. Thank you for the invitation. My name is Karin van Nes. I work as a pediatric dentist in the Netherlands at the ACTA University and also in the Center for Special Needs Care. And that's it. I'm yeah.
Okay, thank you very much. And I think just to catch you up, we're in the middle of the discussion on the goals of the SIG, and we've already had some really nice suggestions. And now it's Monique who raised her hand. And you have to unmute.
Yeah. Thank you. I agree with what Guglielmo already brought up and what Yoke has said. Is there a way to actually get a list of best practices? Because there are so many nice projects out there, and are there ways to discover how we can translate those best practices to other communities?
Yeah, I think that's totally in line with what I haven't seen any best practice on, like co-creation in dentistry, at least. There are a lot of guidelines, I think.
Yeah.
In other areas, but I think it would be really, really relevant to have some sort of look into that from a dentistry point of view, if that's what you're.
Yes, but I think there are already projects out there, maybe not published, that have been done as part of developmental work in several countries, which may not have been published, and that may be the reason why we are not aware of it. So it may be, I don't know if we can get that information to us via either a questionnaire, via different dental institutes all over for all countries all over the world, to see what kind of projects are working out there and what kind of dental outreach programs are being run in those countries. I mean, I get several requests each year from different outreach programs that are organized by Dutch foundations, going to Indonesia, going to Kenya, going to South Africa, going to Nigeria, for instance, that are helping out. And not all of them are just sending the dentist and taking care at that time. But in several of those projects, we know that people are actually working with people in the community, coming up with, hey, a water pump is a better idea than bringing in the dentist to improve oral health.
Yes. Well,
so the co-creation is already ongoing.
Yeah. But as you say, it's a matter of getting the information, sort of, right? So we could do some outreach ourselves to find out about outreach programs, so to speak. Yeah. Okay. If I understood you correctly. Okay. And then Ambrina?
Yeah, I totally agree with what Monique said. I think, yes, we all in our countries are getting this data on and off, that how many people have visited so and so communities, and they have been like providing prevention and primary health care and all. But again, I don't see any future in it, to be very honest. Because unless and until we don't really do a scoping review as to whether they are actually working or not, and whether they are with respect to sustainability, remember? So we are talking about sustainability. These projects are only sustainable if we, like, for example, in my understanding, when I involve my undergraduate or postgraduate students, they go and conduct these these projects, they are sustainable. But when the minute they stop doing it, that service is lost. So I don't find any sustainability in this kind of things. Now, second thing, which I wanted to highlight, we are talking about prevention, right? So we know that prevention through promotion is being done through community services. But then what about the social services? Are our social services really ready to incorporate oral health into their larger projects? Because I have never seen oral health aspect in any of the holistic. When they talk about holistic approach, oral health is missing. That's totally missing. Just yesterday, I was talking about you. Just yesterday, we had a meeting with the lady health workers, and we asked them whether when they go and get themselves engaged with the pregnant women, what do they actually do? And they were like, we check their diabetes, we do this, we do that. And then I was like, what about the oral health? Do you really open their mouth and check what diseases they have in their mouth? Are they using in my society? There's a lot of pan, gutka, chalia, and all those stuff, the smokeless tobacco products that the pregnant women are using. Do you really check whether they are using or not? And they were like blank, completely blank. No, we do not. So, Lady Health Worker program is for the last 50 years, and they have not still once opened the mouth of a pregnant woman to check that they are suffering from any gum disease or they are having any bad oral hygiene or anything. So, and lastly, the very, close to my heart, one thing is the scaling. Scaling is costly. It's a clinical procedure. We charge scaling. The simple prophylaxis we are charging in our country, and I'm sure this is the same case in your countries also. When the patient comes to your clinic for a prophylaxis, you charge them. And I don't understand, why are we charging a prophylaxis or prevention? Prevention is supposed to be free, right? So why are we doing this? So these are certain things that I really wanted to see if there can be a review that can be done across maybe low middle income countries, or comparison between low middle income and the high middle income. And let's see, as I think somebody mentioned, evaluation is very important. Joke, right? Joke, whatever, I don't know. I'm not pronouncing it correctly. So you mentioned about evaluation. So unless and until we don't look into the evaluations and we do reviews on that, I think it's the prevention to be sustainable is useless.
Okay, thank you, Ambrina. And again, I'm just gonna rephrase to make sure that I understood it correctly. You back the suggestion about doing kind of going into the outreach programs and the sustainability of those, and then you're talking about the social services. And I agree with you that there are a long way to go to incorporate oral health in the social services, but I do think that some has tried to, at least. So one way to go again would be to go into the literature and see, okay, what's actually been done and what worked, what haven't worked, and why hasn't it worked. And then you talked about prevention, like scaling. I think I agree that it's important, but seeing as our idea with the SIG was more of a non-clinical focus, then maybe, and I think we need to limit the number of reviews we have to do. We're not that many people, but thank you very much for your suggestions. Lamis?
Yes, thank you. Honestly, thank you, Professor Qureshi. Honestly, you are like, I believe when you are speaking about what happened, for example, in countries like mine and other low and middle income countries. So honestly, believe in my experience, I believe based on observation, it's not a research, the main obstacles for sustainability in low and middle income country is the ongoing healthcare system policies and how the policy makers look to oral health prevention. This is the important thing. So I have my experience in implementing community-based oral prevention intervention in maternal oral health programs and also school oral health program. The possibility of sustainability is so high. And even if we haven't in future, of course we need fund, but it's not in the way that people imagine that it's so huge. No, it's not a problem because there is a lot of sources within the country can help in this fund in the future. But of course, I'm not like I am from area suffering from conflict and a huge destruction of the government infrastructure. But in real world, we can look for health insurance and how to incorporate prevention within these services, and it's possible, extremely possible, and that's what WHO I believe it's working on. The other point is taxes, and there is many resources can be involved, and of course the external fund would be helpful, and mainly for the countries that now under like where there is no high productivity or its income is for very low. So I believe that now it's still not clear for us what is the main barriers for sustainability to use it as an evidence-based, and not only the main barriers, also the main facilities available in our countries or more in low and middle income countries to use it as evidence-based to build our to help us in building our interventions and involve this key important aspect into intervention to show the long-term sustainability. Actually, I have always this question in any application fund I submitted. So it's so important to consider that, and that's why I'm joining this group.
Okay, thank you very much, Lamis. And what I hear you say is that we need a policy track And I agree with you that based on the output that we're going to create, we could have a policy track to look at like kind of saying, okay, here are the options, here are the possibilities, and the facilitators of sustainable interventions. Thank you. Then we already, now I've written down, and I'm going to show you it in a little bit, the suggestions or kind of the goals that we want to go for. And then I would very much like to hear your input on the kind of the activities. So how would you like to be involved in this SIG? Should it be like this, online meetings? Does that work for you in this group here, or do you suggest something else? Please let me know. Guglielmo? Guglielmo, yeah.
Because I just not raised the hand. I just say the come up.
Sorry.
So I agree to do online meetings.
I'm terrible with emojis.
Me too.
Sorry for that.
I know you too.
Sorry for that. Okay, so thumbs up for online meetings, and I've seen thumbs up other places now. Yes, okay, perfect. So online meetings works for you. So the next I would need to ask you is if we are gonna do like guidelines or reviews or stuff like that, how are we gonna do it? So I mean, everybody here is busy people, I think. So so if you have any good ideas or suggestions on how to do it, yeah. And I think that's a hand, Guglielmo, and not a thumbs up. So.
Yes, it depends because all of us, I think they're very busy people. Also, the work can be quite large. So or we divided the work, or maybe we have to use some kind of artificial intelligence help to just help us. Just starting from the simple Ryan, I don't know how familiar you are using Ryan, or also using like Purple or Shite, just to shorten it a bit the work. Otherwise, it can be a very huge work just to do something like this. Maybe we have to include more than 100 papers. So that means that we never finish. Because one of the things that I hate about this kind of review, that when you finish, you discover that because maybe past 3 months, new papers were published, and then you start again, So I really think that you have to find a way that is feasible, easy to do, and also faster.
Thank you. You okay?
Yeah, I'm thinking about two things. First is that I think it's difficult to kind of figure out what exactly we're going to do or being looking for as long as we haven't specified the goals. Of course, unless we keep it broad and we say, okay, we want to have like a general strategy that we want to bring out, that's something else. But maybe I would think that maybe it could be useful to have a first meeting to specify the goals. And then in the second stage, actually going for it, making sure that we can say something about that goal and doing or a literature review. But I think on whatever topic we will choose, a literature review takes time. And if it comes from ADPH, I think it should be really very well evidence-based and done according to the guidelines that are present for reviewing literature. So I think that maybe it could also be interesting to have this as an expert group and not seeing this like as a systematic review or a scoping review, but rather as like a co-creation thing amongst experts to see what comes out of that, to do kind of recommendations that we could circulate amongst other members of the AADPH to have a kind of opinion from our group rather than something evidence-based, because I think that it is a lot of work. We have now been, we are now writing the projects for the mental health sector, and there will be 2 PhDs on it just to set the goals and to find out what strategies. So that's 2 people that will work full time 4 years on it to do this properly. So I think it will be very difficult to get something out that is on the level that we want to have it, unless of course we say, okay, this is like an expert group and we brainstorm about things and then we give our opinion about things. Then of course I think that's maybe a bit more feasible.
In a way, if I can add something, I agree completely. But if we have to be based on scientific evidence, we have to do some kind of literacy search or something like that. Because even otherwise it doesn't work. And also what is valid from scientific evidence maybe is not possible to do in some, let's say, areas of the world or something like that. For example, now I was thinking about I'm trying to collaborate with the Burkina Faso government, but they cannot use the toothpaste because they have no tap water. So we cannot use fluoridated toothpaste for that. Or in Burundi, they have the water, but the water is absolutely not drinkable. So again, they cannot use fluoride toothpaste, but fluoride is maybe one of the base of the prevention. So we have to find a way how to deliver the fluoride, if it's possible, yes or no. So it's really tricky in a way. I agree completely with you that we don't have the time. It's not needed another systematic review again, and maybe not even a Scopus review, but if we have to be based on scientific evidence, some kind of literature research is needed. Or maybe we can just follow the guideline in general and see how it's possible to adapt to different, let's say, population and areas of the world.
Thank you very much for your suggestions and idea. And I agree with you totally that it can take a lot of time to do if we need to do like a systematic review. And this is why I haven't written a systematic review in the activities, but more of a scoping review or opinion paper, something like that, because I think we need to go through some sort of literature. One suggestion would be, at least I have contact sometimes with master students who ask me for guidance, and I could suggest the topic for some of them to start the the going into the literature at least, so we could get some sort of like idea of what's out there. Oh, Ken?
Well, that is exactly what the group I'm involved with is doing. We have some postgrads, and actually what they're doing will help you, because they are doing a narrative review for oral health promotion projects for children and adolescents, particularly for those who are socioeconomically deprived. And that's quite a broad area, but I think the results of that would help this group.
For sure.
So that's is being done, so we can get it done in a year. Also, through the Oral Health Working Group of the World Federation of Public Health Associations, they've recently looked to find oral health promotion projects around the world, and they've done 8 cases as examples, one of which is Child Smile in Scotland. Now, I don't know if you're aware of Child Smile. It's been running for 20 years. It has been thoroughly evaluated, not only from the effects on oral health, but also on its economic benefits. And the Scottish government have kept on funding it for 20 years because it's worked. And I would suggest to all of you that you should Google Child Smile and have a look at how that's been run, because you'll find there's some excellent work there. And it is, I think, the only oral health project which is actually recognized by the European Commission and on their website. So that would be a very useful thing, I think, for you to have a look at. How it was set up, what the baseline was with regard to carers' prevalence in Scotland, in children. What it now is, how they've achieved it, and how much money they've saved the health system there by running this project, which largely involves nursery schools.
Yes, thank you, Ken, for that. I agree with you. It sounds like what the other group is doing have some good synergy with what we wanna do.
You should liaise particularly with Jitana Redelian, who is the chair of that group, because it'd be crazy for you to double up on what we're doing in one aspect anyway.
Perfect, thank you. Can I ask how many of you here have contact with students who are going to do some sort of thesis or yeah, there are some, and I think maybe that could be one way to go to get into the literature if we agree on exactly what the goal and what the scope of the literature should be. Then we can do that if you agree. We can I can write an email, like a string email, and you can tell if you have any students who could go into that work. I think Yoga, did you have something you want to say? You unmuted? No. Okay. Thank you.
Yeah, so I wanted to say something. We recently started working on writing a scoping review on oral health, and somehow our team split up, and we were not able to do that. So we can actually that you can think on that also, because oral health is under work in so many countries. So what are the benefits that oral health is given with regards to prevention, and how sustainable it is? So maybe we can look into that.
Okay, so I'm just gonna share the screen, and can you see what I've written, or is that you can see the goals here, right? Yeah, good. So this is just a sum up of what we've discussed, and please tell me if I've misunderstood. So what we talked about would be nice to have some sort of guidelines on the possibilities for preventive strategies in deprived populations, because that is, as I understand it, a problem in all countries. And then we're talking about, are there some sort of best practice on co-creation in dentistry? So how do we evaluate it? Is it useful at all? Is it evidence-based, or are there other approaches? And then we talked about sustainability of outreach programs. That's how I heard it.
We were not seeing your goals. We were seeing another page, I think.
Okay, sorry. I can say stop sharing and share again. And I think you can see maybe. Can you see now the goals?
Yes. Yes.
Okay, so these are the guidelines we talked about on the possibilities for preventive strategies. We had the best practice on co-creation in dentistry, talking about how to evaluate co-creation projects and the effect of them, the usefulness of them, and if it's evidence-based. And then we talked about sustainability of outreach programs, as I heard it. And what we talked about was, could we come with some expert opinions on it? Could we do some narrative reviews by maybe including some students? Is that a fair sum up of what we've discussed?
Yeah, I think so. Regarding the sustainability of outreach programs, I would like to get some more knowledge on whether or not these outreach programs are provided top down. And some of the outreach programs that I'm aware of really seem like dental tourism. to see what, or are these really working with the people?
Mhm.
I completely agree with Monique.
Because there are too many programs out there that are working on people rather than with people
Yeah, I agree.
and for people.
But that's fine. I think that's a good point, and I think that could be one point in this kind of topic to see how are the programs designed and does it work? Maybe is it good or bad that it's top down? Yeah, thank you for that. So my suggestion would be that for now at least, I can try to take this sum up and write it down in a more like official manner. And then one way to go would be that I send it to you, and if there are some of these points of the goals that you are especially interested in, then let me know, and we can have somebody working on that. If you have either time yourself, which is maybe not so realistic, but if you have some students who can help you. And I can say that from my point of view, this one is something that no matter what, I'm going to be working with, because I find it very interesting and useful. And hopefully I can find some students who would like to go into that, because I think that's really the basis of making good interventions. So please comment if you have any other suggestions or idea. Okay, I would very much like if you could all write your name and email in the chat, because I'm not sure that I've received an email from all of you. I've received emails from a lot of you, but maybe not from all of you. And I've also received emails from someone not here. So please write it in the chat, and we will copy it to write you. Perfect. Thank you very much. So again, I'm just gonna try to sum up because sometimes when you have these sort of meetings, then you discuss and you think, oh, all these good ideas, we're gonna do all this, and then blah, nothing happens, right? So we're gonna try to avoid that, and we're gonna avoid that by letting it be up to me. I'll take it on my shoulders to try to write a more like stringent, these are our 3 goals and how to reach those goals. And then I cannot do everything myself, so then it would be up to you and the rest of the groups that maybe are not here to say, okay, I want to work in this area, and I have some resources. Or maybe you would even say, I'm interested in this area. I have no resources. That's fine, because then we would know. So yeah, Karin, you have a comment?
Yeah, I couldn't find lift my hand. Yeah. I want to ask something. You gave a timeline, like a very broad timeline, and maybe would it be possible to narrow it down a little bit more, some more details, or that we can also, when you say have these goals, said that we can like subscribe for each goal, and that some kind of list is possible that we can subscribe, and we can know how we can find each other to make something work? Or do you want to do I don't know what your next step will be, or when these non-academic people are being involved, or
well,
do you have some more
I think
information?
when we had the 3-year timeline, it was easier to try to say, okay, then we can have the non-academics involved at a stage. If we get the next 2 years also, then I think that would be the next step to try to involve them. But I think the next step for us would be that we create kind of, as you say, a subscription. Okay, I want to work on this. Is interesting for me. I want to work on this, and then we can make a timeline for each kind of goal, right? So and then we could create like small groups within the groups who would like to work on that. I think that would be, because then you would have to then you will only work on what you think is interesting yourself. Guglielmo?
Okay, maybe. What I will just to say, as really the time is running fast, we have to decide that before Christmas. Absolutely. Otherwise, it's just 2 months that pass like this.
Yeah.
Usually, I don't know what are your feelings, but for me, December is not a month, it's a week.
Yeah.
So I really think that we have to plan or to meet again before Christmas, or to decide in which subgroups, which are the deadline, etc., etc. I don't know if you agree with me, eh?
Well, I agree that time runs fast, and I agree that December is a funny month. But I think what would be good was that at least I will do that quite soon. I will send out to you the goals, and you will write back to me what you think is you want to work on, what you think is interesting, and then I suggest to meet up in. I don't know if we can make it before Christmas, but maybe in the beginning of January or something like that, because then we already done the work beforehand, right? To put into groups, and then we can meet up and say, okay, each group we can make in Zoom. You can make breakout rooms, right? So so we can make a breakout room for each goal or what you wanna do, and then we can make a more feasible plan for the next, let's say, 4 or 5 months or something like that. Good idea, Guglielmo. So, okay, summing up again. I'm gonna write you an email with the goals, and I'm gonna call you in for a meeting again in the middle of January. Okay. Okay. So thank you very much. I think you've all done beautifully and joining this group. And I hope to see you again soon. And write me if there are anything. Okay. So have a good evening, all. Take care.